Warning: this will be talking about topics that might trigger you. Be aware before continuing on watching and listening to this episode. Thank you.
Hi, everybody. Welcome back to Paolo's podcast, part of our campaign with concussion, pain, mental health awareness. And again, we're fortunate to have Dr. Russell A. Bourne, who's down here located in South Florida, who is my personal psychologist. I'm very blessed and fortunate that he took me on. And anybody that wants to hear how CPMHA was born, and all they have to do is go to our first podcast, and the whole story of our interaction is up there. So I don't need to rehash that because Dr. Bourne and myself lived through that first visit, and it's all up there. And hopefully it will encourage you in your darkest times to reach out to help for the right people and connect. So Doc, we know right now that everybody is, I could say, hey, well, I don't know, with my memory, you could, call me out. I've always liked constructive criticism. I never shied away from it. And I always, I think we said from our first visit is, some people that are going through maybe mental health or in general, had a lot of pain. We hold back things in our session with our therapist or doctor because we're embarrassed of the situation. But if we're not totally truthful with our doctor and the person I call our guide, you're my guide, my coach, that if I don't give you all the information and speak truly honest, then how am I giving you the tools to fix me? So where I was going with this is that right now where the world is it seems like it's always dark lately. We had the COVID strike up. A lot of families are being just destroyed by it. The nation seems like it's dividing. And we talked about this before getting you on camera. I forgot how we phrased the question, and we were going to get into that dialogue. Can you tell me how we would word this? I'm sorry, I should be giving you the question. My mind just blanked out.
That's okay. We were talking about when people get bad news, when there's a loss in their world, whether it's their life, they've been given a terminal diagnosis, or maybe it's a loss as simple as losing a job, or as more complex as losing a spouse to divorce, or goodness knows, having a terminal diagnosis given to you about your own son or daughter. Managing loss, managing bad news, managing upsetting, stressful events. We all encounter them. How do we manage them? It makes a difference, right? So that's what we were visiting about.
And that's the question I wanted to ask you. So thank you for that.
Sure. So some of these, so my response is going to sound perhaps a bit generic and maybe even elementary. But when we get bad news, right, whatever that bad news is lessened as soon as we share it, right? So if we have someone that we trust, it doesn't have to be a trained professional. It can be our next door neighbor. It can be our older brother, our younger sister, our mom, our dad. Just sharing the bad news, right? Everything becomes a little different as soon as you speak it out loud. And so talking about it is, of course, what psychology and psychotherapy are all about. But that's sort of a primary coping skill or anxiety, stress management technique, is to find the person that you trust and you feel comfortable with and talk about it, right? That's an important one. Now, sometimes in relationships, people almost expect that this person will know them so well that they won't have to tell them everything, okay? And then they might be unhappy, right? That this person's not being more helpful, right? My wife doesn't listen to me, and my son won't pay attention, or people at work are not being useful or helpful. But there's an expression that you can't be mad at somebody for not knowing what you don't have the courage to tell them, right? And so even in therapy, if someone doesn't have the courage, we won't re-examine our first appointment. But had you not had the courage to make the appointment, and then after whatever process you went through in the first 15 or 20 minutes, to determine that I was an acceptable person for you to be honest with, we wouldn't have had happen what has happened over the last couple of years, I don't think. But you had to have the courage, right, to tell me. So the person in distress has to have courage. Now, there can't be courage without fear, right? If I run into a house and get your dog and bring it out to you, well, it's just a kindness that I've done. I went in and got your dog. But if your house is on fire and I run into your house, now I'm afraid, there's fear, and I still go and do it. Well, that's courage. So taking the action when you're frightened is how we distinguish a courageous action from just a good action, right? People come into therapy, they're frequently frightened or anxious, at least apprehensive at least, and they have to have some courage to talk about what's bothering them. So that's the first step for coping mechanisms or strategies for dealing. You have to be able to talk about it. Okay, make sense?
Yeah, definitely. But how much, because I mean, this is something I even battled with you at the beginning. It was not, for some reason, I think it's probably, your gift and your calling behind you, that you immediately made me feel comfortable. And that there was where I believe, like, just in every profession, there's good and bad, right? There's people that really excel in what they do, and there's some people that just toe the line and are above par. But when I went with you, I don't know if it was, I mean, in my head, I know it sticks in my head that you I don't know if it was the way you listened to me, or if it was your demeanor or your strength or something. Is it there's something in the patients when they come in, you just let me talk, but I was worried about, I want to come in and get a quick fix, does that probably like happen with a lot of your patients? So you like say, what is this going to do? Here's my problems. I mean, and with everything, is transparent. There's nothing that we hide from the public. My whole story is out there. So I think the first one was, we touched on a really, and I probably put you in an awkward spot, was which immediately you said, so which brand, I think if it's not verbatim, but what brought you in here? And I just didn't see any positive light in the future. And I rationalized in my head that, I don't have any children, any great responsibilities anymore. And I just couldn't see myself with my disease, what the outcome is, since there's no cure. And you told me, and then I was also worried about being Baker acted, and we discussed Baker Act with the previous Dr. Kelly Everson. So we got a clear description. That's the audience, so I don't need to go into that part. But you put in, so how would you explain to maybe people how to convey some very sensitive subjects, whatever they're dealing with, trauma, to the psychologist, so that trust is built and no one jumps the gun, or how to communicate with your therapist?
Well, I think,
Because there's laws, right, for certain things. I believe that's what you tried to guide me on, how to present things.
right. So I think they should be honest, right? Obviously, we're talking about that, having the courage to be honest. And if they are inclined towards hyperbole and exaggeration, I don't care if I die right now. Well, they need to say, I don't really mean I don't care if I die right now. So they can be honest without being dramatic or using a lot of exaggeration, right? The therapist, on the other hand, the psychologist, the counselor, whomever it is, their primary job, as you've already said, is to listen and see how much risk there is here. Let's do a little threat assessment. How much risk is this person under? And how might I be able to get a little bit of hope from them? a little bit more optimism. When somebody is dying, somebody's had a terminal illness, our optimism is going to be time limited. I mean, this person's not going to become a physician between now and the time they die. It takes too long. They may not be able to see their son or daughter graduate from college and get married and have children. It might take too long. But what can we do? Well, how much hope can we have for a closer future? Not a long future, but a closer future, And we sort of did that with you. We said, well, let's look at what can happen within the next 30 days. Right? Let's look at what might happen within the next 6 months. Right? Now, I don't want anybody listening to this think that I take lightly the responsibility of being a psychologist, but no one can keep someone from hurting themselves if that's what they want to do. So we're not policemen. We're not armed guards. Our job isn't to sort of lock you up and keep you from, because you're going to find a way if that's what you want. Our task is to get you to want differently than that. You already want to hurt yourself. I want you to want something else, right? And you have to help me know what that want is. I can't just give you my want to take a boat ride, right? Or to learn how to, be more computer literate. I mean, but what do you want? And you sort of wanted to help people, right? So then from there, well, how? Which people, right? What would you do? How would you do it? So again, you've given me credit, but really the credit goes to you. I asked a few questions and you formulated answers that allowed you to stay a bit more optimistic about the purpose that you could have, what you might achieve, what hope you might bring to others or education to others. And that's what you're doing. Right? And it's sort of what we all do, whether we're depressed or have traumatic brain injury or multiple sclerosis, whatever our illness or incapacities are, we still want to be helpful. We want to matter. So what can we do that means our life mattered?
Yeah.
Right.
Well, I think that's why that original dialogue, the first impression with your doctor or whoever you are within a safe place that you're going for guidance is that first visit's got to be the most critical one, correct? Is that, or is it so I felt like we just connected right at the beginning, but maybe our relationship's not really part of the norm. Maybe it just evolves. I mean, because it's work, what we put in, how I am with you. I use every minute of your poor time. I mean, I feel like God, I was like, but you say it's my time, but you're sharing your life with me and really being in there for where I have no other help. And this is where I get it from. And so is that the typical way for a patient, or you can't really put that people in a box, right?
I think successful, doctor-patient relationship builds and deepens over time. Yeah. But I think both people have to value that time, right? There are only 168 hours in a week. It's a very small number. And somebody's going to give me one of those hours. I have to really value that time. That's an important time. Can't waste it. And I want that person to feel the same way. They get one of my 168 hours, and I don't want them to waste it either. And so between the two of us, maybe something meaningful will happen.
So now I'm going to pivot on to what should you expect from when you're. I was blessed. I wasn't really shopping for a psychologist at that time. Obviously, we met through Sinette, who introduced me. She was like guardian angel, and just knew I was on a downward spiral, and I needed help, and I was trying to be proud, and I thought I was thinking rational, and so that was kind of a lucky intervention that put me in touch with you, and then our relationship took off from there. What should, no matter, they don't have to be an extreme case like myself, but say anybody that's going through a mental health issue or just a tough time in general, what should they expect from a psychologist, a therapist, a social worker, even a guidance counselor from school to find out what should they expect from them when they seek out their help?
Well, in the broadest right? The broadest terms, they want to be respected. They should expect respect from this person, that this person will listen, that this person is there for a reason. And we are presuming that reason is that that professional cares and wants to be useful. They can also expect some new information. You didn't want just to have your hand held. You didn't want just to have your shoulder patted. You wanted some information. So a person leaves my office. Whenever they leave my office, my hope is that when they walk away, they have information that they didn't have before they came in. They know or are thinking differently about something, right? We didn't just visit over coffee. That's not what we did. We talked about things that matter, things that are important, and they should have some altered perspective or some new information about that. So respect, care, listening, some new information, maybe a strategy, maybe let's do this, let's do that, see how that works, right? So a plan of sorts, a strategy. That might be enough for one appointment.
Okay. And then we have some leads now that we have a strategic partnership working with NAMI is that we have a referral system for people that can't afford different scale rates because a lot of insurances don't cover psychology. And like we learned, the system is kind of broken because we, in general, I believe, I shouldn't say we and speak for anyone else, that the mental health is a national health crisis, I believe, and it's underserved. And like, in order to get somebody, what other type of services and how could people reach out and find somebody? And I remember asking you that question. You sent me some links, but fortunately, Dr. Kelly Everson is the president of South Florida NAMI's Association, and they're working with us now, so people could go there to find out free programs that are out there. And do you recommend what's the difference between group therapy, like we're going to have volunteer online group therapy, and working private? What's the pros and cons or benefits? Is it a transition that you recommend for somebody that's never had any type of therapy before?
I suspect if someone can find an individual therapist, if they've never had any therapy before, they're going to find that more useful or more helpful. They're going to feel like they're getting someone's complete attention and thoughtfulness, and they probably will find that more helpful. Group therapy, group treatment approaches seem to work best if all of the patients are of a similar need, right? So if they're all like Alcoholics Anonymous, if they're all alcoholics, or if it's an adolescent group for socially inhibited or shy, poor social skills students or young adults. So if they're similar, right, similar population of folks, they're probably going to benefit than if it's perhaps too diverse, right? So someone who is phobic isn't necessarily interested in listening to someone who's depressive, right? So, but if everybody there has a phobia, then maybe I'll learn something about how you manage your phobia and it'll help me manage mine. So anyway, so individual maybe in the beginning and then group afterwards if they feel comfortable in a group setting.
You have a variety of patients that we mentioned earlier in chapter 1. Would you format, because on like my insurance plans and stuff, and Dr. Everson, she said she has 10 practitioners that specialize in each certain topic. If someone was to reach out to you and you were taking patients, which you're not right now, or the waiting list is long, how do you find the best fit for the doctor, male or woman? Do you like to have, would you recommend it be gender specific? Like me and you are both men, testosterone, we might be able to relate to different situation. And I don't know what the saying is, Mars are from women, Venus, women are for, what's that saying? So would you recommend a woman see a woman psychologist? Does that not apply to your science?
I think a lot applies, but sometimes we prefer to believe that it doesn't, right? So we prefer to believe that the skill that a psychologist has, that skill will be universally useful to males or females, young adults or older adults. I mean, but it's not true. There are obviously these variables that everybody has this mindset, right? You just said these two men, testosterone, big guys, they're going to get along fine together. Well, I've had big guys in my office, maybe not quite as big as you are, but they're not so happy to be there with me. They would prefer maybe someone who is more, maybe just younger. Maybe they didn't mind a male, but they didn't want a male that's older than their father, right? They don't want to hear. So we have these prejudices or stereotypes or mindsets that we carry around, and we may not even know that. I'm not sure why I didn't like him, but I sort of didn't get along with him as well. Again, maybe because he was the age of your father and you didn't want to see somebody who was the age of your father and hear your father's voice, or so for whatever the reason. So I think that the patient sort of knows. I've had mothers phone me, and they would like for me to see their young adult daughter. And I say to them, your daughter's 25, right? I'm old enough to be your daughter's grandfather, right? I don't think your daughter wants to come see her grandfather for counseling, right? And they'll say, well, maybe we should let her decide that. And I'll say, well, that's exactly what we should do. You tell her, here, I'll send you my bio, whatever, you can get it online. You let her read it and she can decide. And sometimes they go, no, this is exactly who I want to see. I want to see somebody who had this experience, that experience, been around the block. Other times they say, no, I'd rather see a 35-year-old female. I don't want to see. But anyway, so we have these mindsets. And so you have to ask the patient, right? If the patient doesn't care, well, that's fine. Wonderful. Then get whoever you can get in with the soonest.
What are some warning signs that a parent or a loved one, I guess it doesn't even have to be a parent. I always think of the parents are the ones that are protectors, but it could be a spouse, it could be a friend. What are some warning signs that maybe, because talking about mental health or somebody that maybe might be not wanting to share, but some symptoms or some signs that they're not in a good place, when should someone, say, hey, you know what, maybe I'm not qualified to give you this advice. Maybe you should go and speak to somebody, because if I give you advice, it might be the wrong thing. Here's somebody that's trained, is professional. It's done wonders for me. I mean, you've kept me alive for I don't know how long we've been seeing each other now. It seems like yesterday for me. I know you, it seems longer. So what are some of the signs that we should be concerned? Are there warning signs? Is there anything that it's like textbook, okay, this and that, if someone's talking? Because I remember one of the things you asked when I told you we have our own commitment to each other, that because of the time you spend with me is before ever I act out or do something, is that we have a promise to each other, is that I would reach out to you and talk to you first, and just as being respecting each other's time and commitment. And I thought that was wild, but I'm a man of my word, and I've done that. And in one case, it actually made me think it through. You didn't even talk me out of it. It was just, I remember the situation where you were like making me think about the situation, and because I didn't have it planned out. And then I was like, wow, there's a lot of thought that goes into it. It wasn't impulsive. And then I would chicken out, and I was like, and that's what I come into, is like, you'll do something. You might not think you said something, but then I'll take something out of it, and then I'll go back in. And then I think it was like a week later, I told you that I had a hard time breathing, and I was actually scared to die. And so here it is, where somebody wants to take I didn't say easy way out, but I was just so suffering so bad. I just wanted it to end. And a week later, I felt like, all right, things are getting worse. I can't handle it. Now I want to fight to live. And you mentioned that the suicide part was impulsive. It's usually an impulsive behavior. Is that the first instinct? So make sure, that's why we came out with the 3-day rule, like the checks and balances, right? So is there any, besides suicide, is there anything that you always want to make sure, like you asked me if I had anything that was harmful around me? It was like, do I have it, was going to do, I forgot your checklist that you had with me. Is there anything that maybe the parents listening or a friend listening is concerned about their friend that they should bring to the attention that you can think, or is that too broad of a question?
Well, I think the first part of your question was what to look for, right? What do you see and when do you know to say something to someone? And again, if you know the person pretty well, you probably get a feeling that the person's not themselves, right? They're either more happy than usual and kind of too up, and you wonder if that's drug influence, or they're sadder and mopier than usual, and you wonder if maybe there's a friendship that's been damaged and they're in a bad mood. But when you notice something that's different than the person is in general, I think you go to them, or maybe you watch it for a little bit. It's not like every day, but when you feel like that person's been a little too mopey or a little too excitable for too many days in a row, you go to them and you say, look, I've noticed that you've been pretty mopey the last 3 or 4 days. Would you like to talk about that? Yeah, whatever they'll say, they'll say. But we talked about honesty. You can't be afraid to go to that person, right? I'm sure there are some suicides that have happened where after the fact, some person who knew that person that committed suicide felt horrible that they didn't say or do something, right? They didn't go to the person and say, I'm not sure what's going on, but you don't seem to be yourself. And they didn't do it, not because they didn't care. They didn't do it because it takes a certain degree of courage. You're a little frightened. Am I going to offend this person? Am I going to hurt our relationship? Are they going to get mad at me? Well, they're worth it. Let them get mad at you, right? I mean, I've told patients before, look, I know you're going to be mad at me, but unless we come to a different agreement here, I'm going to be unable to sleep tonight when you leave this office, right? I can't just pretend we haven't had this very serious conversation. That's not the way my mind works, right? So you can get mad at me for saying it. You can get fussy with me and swear that you'll never come back and that'll be a loss. But if I feel it or sense it, I have to say it. And I think a parent and I think a friend sometimes feel like, well, it's just going to make matters worse if I bring it up. It's never going to make matters worse. It's never going to make matters worse, right? Because through conversation, there'll come some clarification of what it is that you're seeing and whether or not it's risky.
All right. So we're going to move now to next week, which will be our final chapter with Dr. Russell A. Bourne, chapter 3. And we'll be finishing. So we'll be back next Wednesday and you'll be able to get the conclusion. And please leave any comments, any questions that you have for Dr. Bourne at the bottom of the box. And Dr. Bourne has a very busy schedule and a very large family. So we'll do our best to get back to you or post some information. And that's it.
Thank you for watching Paolo's podcast. This concludes Chapter 2 with Dr. Bourne. Please tune in next week, January 27th at 11 a.m. Eastern Standard Time for our next chapter, Chapter 3. As of 2021, CPMHA has launched a new charity GoFundMe, and we strongly encourage all viewers to consider donating. Please consider helping us reach our campaign goals, as all proceeds go towards funding our company and into forming our programs and operations to give those in need access to free resources for coping skills and connections to get them through this national health crisis. The charity GoFundMe link will be posted in the description of all future streaming platform videos. Thank you, and don't forget to check out our company website, cpmha.com. And remember to like, subscribe, and hit the notification bell in order to receive notifications each time we post a new podcast.